So talk to me about the relationship between retail pharmacy and specialty pharmacy, and what advantages or efficiencies do you gain by having both of them in a system and coordination between the two?
When you have a retail and a specialty pharmacy on site, then you can ensure that the entirety of the patient's prescription care needs are met. So they may have a prescription coming out of the retail pharmacy and out of the specialty pharmacy, and we can ensure that they get both, that there's no delays on either, that each team knows what the other is doing as far as providing for that patient, and even to the point of combining that shipment. If it's a prescription need that we need to mail, then we would be able to bundle that up and get it to the patient all at one time.
So in our pharmacies, where we have retail pharmacies and specialty pharmacies, could I call the retail pharmacy with a question and get an answer, or about a specialty drug, or help coordinate that way, or is it just completely siloed?
Yeah, so yes, you could, because either place you're going to end up with a pharmacist that's going to have the education needed to answer most of the questions. But when it comes down to the really clinical, anything about patient monitoring or anything that has to do with the really high complexity meds, then we would end up getting our clinical pharmacist for that disease state involved, because they have the training, in-depth training and certifications they need to really address the patient's questions.